Okay.
You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show, where we talk about healthcare and kind of fixes and, bad things, good things, how we're all in this healthcare system, how we navigate it, how we can do better for ourselves, get better care. Jeannie Rollo is my co-host. She's in Indiana. I'm in Florida. A lot of the stuff we talk about are personally things that happen to us, but also people that contact us and people that we talk with every day that things have happened in the healthcare arena and how, again, that we can get better care for ourselves. Doctors and nurses have been on this podcast as well, talking about how it is difficult for them to navigate the same healthcare system that they did maybe 15, 20 years ago when the rules and the atmosphere was seemingly different from what it is now. And so that's what we're trying to do with this, trying to educate people and keep us all on the same even keel, if you will. And sadly, we keep coming up with stories, I want to say daily, Jeannie. I know you do. And the one that I want to talk about today has to do with many, many podcasts that you and I have talked about and have had people on with the drugs, the high-powered drugs that are used for us in surgeries that maybe don't necessarily have to be. Again, we're not doctors or lawyers. These are our opinions. These are the opinions of people that we've talked with that don't necessarily have to be used for those surgeries, and why seemingly sometimes they're just given willy-nilly. I know in my case they were, and the case that I'm talking about now was a gentleman that was in Boca Raton, Florida, here where I am, that was given a way, way, way too strong dose of the opioid Dilaudid, and his wife won the case to the tune of $20 million. I don't know how much money she actually gets, and they had a younger child at the time who now doesn't have a dad because the dad died. And some of what I read about that was when he went into the ER, he had been asked if he had respiratory problems, and I think he said yes from what I remember of reading it. But it was very specific that if you had sleep apnea, which this drug certainly wouldn't have been given, I guess, as a bad side effect for somebody that has sleep apnea because it just slows everything down. Well, anyway, the guy died, and they proved that he had a really excessive amount of the drug in him. And, Jeannie, you're familiar with that. I certainly am in my case on why, when they asked the doctor, and the doctor's like, well, I asked the right questions and whatever. Did you ask the right questions if this gentleman wound up dying? I mean, and we've said this so many times. I know that I tried to tell side effects, and I was told my side effects were invalid, that they didn't matter, right, and it wasn't going to make any difference, and they gave me the drugs. I mean, I didn't die. It's, really, really sorry for this gentleman in Florida and for his wife and his daughter, but it messed me up really bad for quite a long time, and they were like, well, it is what it is, and that's what we use for these surgeries, and, basically suck it up, and that's it. And, wow, Jeannie, what do you think?
Well, one thing I wanted to say, Cindy, is in the article that we were reading, it never said that they did the questions, that it actually did say that he didn't ask any of the history. So, that's very concerning, and he certainly didn't ask if he had sleep apnea, mm-hmm. which would have been very dangerous. And the same with my husband, and probably the same with you. He was never asked if he did. So the very same could have happened to him. But this guy got massive doses of this, and he wasn't properly monitored. Even mm-hmm. having been given those massive doses, he didn't agree to any of this, as what I can get out of this article, which my husband never agreed to it, but they did it anyhow mm-hmm. because they always seem to think they know better. So, well, and this was during COVID.
Right. And it's their protocol. Right. It was during COVID. And it's their, quote unquote, my opinion, their protocol. So why are you asking us the questions that have been asked? So I thought that it did say that they asked him if he had respiratory problems, but never specifically asked about the apnea, which would be, totally specific to this drug, that you'd have to be monitored, like you said, 24/7 or however long you're in there for if you're on this drug right. and you have sleep apnea. So really serious. So they pinpointed that this is what's going to happen. But why ask the question if you're just going to say, oh, those aren't valid side effects? or in your
Right.
husband's case, don't even ask the question. I don't get it. I really don't. And just say, oh, you signed the consent form, so everything's good. I don't get it.
Well, yeah, like in my husband's medical records, they answered questions that he was never asked, and they answered them to suit the agenda that they needed to have done. So yeah, that happens too. So I'm not really sure on this guy, but they didn't monitor him like they were supposed to. I mean, they have to, because you cannot put people on those high-powered drugs and then just kind of shove them off into a closet. Not that they necessarily put him in a closet,
right?
But you understand what I'm
But I mean,
saying.
you just didn't pay attention to him. And I mean, Dilaudid is a high-powered drug. I mean, we've talked about it with fentanyl. I mean, everybody knows you can make it any dosage that you want, any strength that you want. I mean, come on. I mean, why are people even just ordinarily being given these drugs? A lot of doctors are, saying that themselves, that they know that it's not right, and they're changing their protocols and stuff, which good for those people, because this is serious stuff. I mean, didn't we learn something from the Oxy mess? I mean, we're still dealing with the Oxy mess, and now you're getting into fentanyl, which so many police officers here locally, and I know it's nationwide, worldwide, say, yeah, Oxy was nothing. I mean, that's the minor leagues compared to what's going on with fentanyl and stuff. And I've had arguments with nurses and stuff on different talks and things that are saying, well, what are we supposed to give the patients? And I'm, like, oh, you're wrong, Cindy, that, it's a drug in our wheelhouse, and it is. I'm not going to argue that any day of the week, but you got to really monitor this stuff.
Right. I mean, and from what I read from this article, they couldn't even say when he stopped breathing because they weren't monitoring him.
Right.
So they didn't really know when he stopped breathing, and then he had extensive brain damage. So
serious.
It's just sad. It's sad.
It is sad. And you know what? How many times has that happened to people and they didn't die, but they had serious side effects for quite a long time afterward? And it's so sad to hear that this gentleman had to die for something to be a little bit done about it. But I mean, what protocol is going to change then where it was where he went into the ER so it doesn't happen to somebody else? That's what I worry about. I mean, is this going to be hopefully a wake-up call? I hope.
The thing about ER is I have read that so much harm happens from ER cases. I know my husband went in through ER and he was harmed. So I really do believe that if you go in through ER, you're really at risk, I think, for the whole stay, because if they don't get the medical history, if they don't get it correct, then that is going to put you at risk for your whole hospital stay.
Mm-hmm. Yeah, I don't know. I don't know any statistics. I mean, we could look that up maybe. I don't know. And talk with people. That's the first really that I've thought about it with going through the ER, that you bring that up, Jeannie. But the whole thing across the board is, don't you really want to pay attention to this and not just be kind of lackadaisical about it? I don't really even know the right words to use, because it's so sad. I mean, it's so sad.
You don't expect to be harmed by medical care. I mean, you just don't expect it to harm you. I mean, if they tell you the risk and everything like that, then you know that there are some risks, but you don't really think that because of whatever, being careless or whatever it was, their excuse, you don't really think of that kind of harm happening to you while getting medical care.
Yeah. Because we go back to the same thing, the trust. It always goes back to the trust. Right. You're incapacitated if you're going into an ER in some way, shape, or form, aren't you? I mean, something is wrong. Are you thinking clear? Even if you have somebody with you, they're not thinking the same thoughts you are. They don't have all the same history you do, in your mind, that blah, 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 at the tip of your tongue. So it's just crazy. And these drugs are brutal and they're strong. And, a lot of people are getting messed up because of it. And it is really sad. But on that note, I'm going to say, stay tuned to Evergreen Media Network. We'll be right back.